Crystal, how are you doing today?
I'm good, how are you?
Good. My name's Dr. Jenny. Can you tell me a little bit about what brought you in today?
Well, I just haven't been feeling like myself. I've just been really sick the past couple days.
Okay. Well, we did a few tests, and one of them that came back positive was your HIV test.
What's HIV?
So HIV is a virus, and it can be transmitted through body fluids, sharing needles, sexual contact. So with this virus, it's going to be chronic, and some of the symptoms that you're going to feel depend on what stage of the disease process that you're in. So for right now, with that, swollen lymph node fever, sort of like you have a cold feeling, that's the acute stage. So that's about 2 to 4 weeks after infection, and that's going to persist for about a week or two. And then once you progress to stage 2, you're most likely not going to have any symptoms. So in stage 2, your body has actually begun to fight off the HIV infection and create antibodies towards it. So your immune system is taking care of it. So most people don't have any symptoms, and that's when we can start you on the medication to continue that stage and hopefully that it doesn't progress to stage 3, which is when we classify it as it's no longer AIDS, it's no longer HIV, it's now the AIDS virus. And then once you are in that stage, you'll see a lot of opportunistic infections, so you get sick really easily because you have a lot of immune system compromise. But hopefully with the viral medication, a lot of patients don't ever progress to the stage 3 and will actually test negative for HIV because the viral load is so low. Now, do you know where the exposure occurred?
Well,
the story of how Crystal contracted the human immunodeficiency virus, or HIV, starts with Dalton and his partner Garrett. Both men are bisexual and had unprotected sex, but Dalton did not know that he was HIV positive. Studies have shown that anal or vaginal sex without using a condom or taking medicine to prevent or treat HIV increases the risk of getting and transmitting the disease. Gay and bisexual men account for 66% of all HIV diagnoses and 82% of HIV diagnoses among males. African American gay and bisexual men accounted for the largest number of HIV diagnoses, followed by Hispanic and Latinos, and then whites. Not knowing that he too is now HIV positive, Garrett meets with one of his friends, Janeza, to get high. Let's see how this transaction goes down.
I don't really want to get high.
I mean, I got a needle, it's used, but I can give it to you. There you go.
The use of injected drugs increases a person's risk of getting HIV. Because they were longtime friends, they thought that sharing a needle would be fine since they assumed each party was free of diseases. Due to this lack of knowledge and continuously using the same needle between them, Janeza has now become infected with HIV. In the past couple of years, there has been an increase in HIV diagnoses in Asians. With Janeza and Crystal being partners, Filipino, and one of them sharing needles, the risk for contracting diseases spread by bodily fluids such as HIV is high. Prior to Crystal going to see Dr. Jenny, she and Janeza had sexual contact, which resulted in her feeling the beginning stages of HIV. Let us now see what kind of nutritional information HIV-positive patients need to know to improve their quality of life.
How to manage your diagnosis of HIV through proper nutrition.
First, you will want to increase your calorie intake by 10% to have increased energy levels. A decrease in food intake may occur from anorexia, fatigue, pain, nausea and vomiting, which can all be due to certain medications. Other factors that can lead to a decrease in food intake may be oral infections, which can cause pain, dysphagia, and altered taste, ultimately making it difficult to eat, respiratory infections, food insecurity, and low income status.
It is important to maintain a diet rich in whole grains, vegetables, fruits, lean proteins such as skinless chicken, fish, which is high in omega-3s, low fat or non-fat dairy products, healthy fats such as avocados or nuts, drink adequate amounts of liquids such as water, limit the amount of sugar and salt you intake. But HIV can also cause vitamin deficiencies. The most frequently disturbed vitamins are B, C, and E, which all play a major role in how the immune system functions and repairing your body.
Along with all of these factors, you need to make sure that you receive regular checkups with your doctor, exercise, and maintain proper hand hygiene.